Hi everyone, thanks for joining us for our coffee break today. My name is Elizabeth and I work at North Range Behavioral Health as a mental health clinician. And today we're going to be talking about recognizing and alleviating panic attacks. So we're going to go over the symptoms of panic attacks, what to expect. We'll look at ways to prevent panic attacks through lifestyle changes or things to avoid. And then we'll go over a couple of exercises for how to alleviate a panic attack when you're in the midst of one. All right, so feel free to post any questions or comments and I'll do my best to answer at the end. So let's get started. So the first thing we want to look at is how to recognize when we're having a panic attack. So for those who don't know, panic attacks tend to peak at less than 10 minutes into the panic attack. They can be very short, several seconds to several minutes, or sometimes they can even go as long as half an hour. So if you're having multiple panic attacks in a row, you could be experiencing symptoms for several hours in the day. And what you want to look for is increased heart rate, heart pounding, palpitations, chest discomfort, pain. You could be dealing with trembling, shortness of breath, or feeling like you're choking, chills, heat sensations. You could be feeling tingling, numbness, derealization, which is feeling like you're detached from reality or that the world around you is unreal, or even depersonalization, which is that feeling where you feel like you're detached from yourself or kind of looking at your life from the outside in. And some of the top three things that we can tend to think of when we're in the midst of a panic attack is either one, I'm having a heart attack and I'm dying, because it can feel like that. Two, I feel like I'm losing control, and so you fear fully losing control. Or three, that you think you're going crazy and you feel like you're losing your mind. And so these three thoughts can really perpetuate panic attacks, because once we start thinking, oh no, I might be dying, we start freaking out because, our survival instincts kicked in and we want to, feel better as soon as we can. Just a side note about symptoms, if you have not been to a doctor and you're feeling the chest pain or discomfort, it's a good idea to go to the emergency room anyway, just to make sure that there's not something wrong with your heart. However, if you have been diagnosed with panic attacks and you're aware that chest pain or heart pounding is one of the symptoms, then you'll be able to recognize, hey, I'm having a panic attack, I'm not having a heart attack. And another thing about symptoms, if you find that after you're having a panic attack, that you're spending the next month or longer worrying about having another panic attack, and the worry is getting to the point where you're changing your behaviors and routines to try to avoid panic attack, it's a good idea to get in touch with a mental health professional, because you could be suffering from something called panic disorder. Okay, and so how do we prevent panic attacks? Anyone who's had one knows that they are not fun, and we don't want to, continue to have them. So just some things to think about as far as avoiding certain things that could trigger panic attacks. The first one is spending too much time on social media. And the reason for this is we have a tendency to compare ourselves to other people on social media, and what we don't always realize when we're looking at other people's profiles and posts is that they're just posting their highlight reel. So people aren't going online posting about, the downtimes or the mistakes they're making or things like that. They're posting happy times, traveling, vacation, promotions, new babies. And when we're looking through our social media, it's easy to look and see that, all the good things that people are doing, and we start to compare ourselves by only those people's highlight reels. And then another thing is overthinking and catastrophizing. So when something happens and we tend to overthink or think the worst, that can really increase our anxiety to the point of getting a panic attack. And often what we find when we are catastrophizing is that, things never turn out as bad as we're thinking. For example, if you call a friend and you don't hear back for a couple of days, and you tend to overthink, something you could start thinking is, oh, I've done something to upset this person. Maybe they don't want to be my friend anymore. And so when we start to overthink, we start thinking, well, what did I do wrong? Did I say something? Has something come up? Like, how do I fix this? When the truth is they may have just not seen the call or been busy. So that catastrophizing really ups our anxiety and can put us at more risk for panic attacks. And some more things to avoid: alcohol, drugs, and caffeine. Mainly especially the stimulant drugs and certain strains of marijuana can really increase anxiety and even trigger panic attacks, just because of the side effects of the drug. So reducing your intake of alcohol is not only alcohol and drugs is not only gonna help you sleep better at night, it's gonna reduce that anxiety, because you're not gonna have additional substances increasing your heart rate and, you know, making your chest hurt, things like that. And so what are things that we can do that we can implement in our lives daily to reduce our anxiety and our panic attacks? So one thing we can do is get good sleep. The recommendation is 8 hours a day. And if you find that you're having trouble sleeping, it might be a good idea to chat with a health professional, your primary care doctor. And then, you know, if you are overindulging in things such as alcohol or caffeine, or you're abusing drugs, it might be a good idea to cut back or get some help if you need it. Another thing, avoiding the news. There's a lot of negative news out there and a lot of scary things going on in the world. So it's okay if you are a little uninformed for a while. If your anxiety is high during everything that's going on, you know, it's perfectly okay to turn off the news and just live your daily life, especially if the news is having a negative impact on your mental health. And another thing we can do is exercise daily. So as we know, gyms are closed, so that can make it a little harder for those of us who do like to go to the gym. But some ways that you can work out at home, you can either go outside, especially on these nice days that are coming, take a walk, jog, anything that you're feeling. You can also turn on some of your favorite music and dance. Or if you're looking for more workout video types on YouTube, you can find plenty of free workout videos. I'm personally a fan of Fitness Blender. They have a lot of short, long videos for any level. And if you aim for 22 minutes a day, you're gonna hit that weekly recommended target of 150 minutes a week. However, if 22 minutes feels like it's too much to handle or too much to do, you can always start at 5 minutes and work your way up, because the benefits of adding exercise to your daily life when you're not exercising at all are still going to start showing themselves even at those smaller increments. And then another thing you can try are mindfulness apps. There are plenty of mindfulness apps for free on the App Store, and a couple of good ones are Headspace and Calm. Those are totally free to use, and they'll walk you through some exercises. All right, and so those are going to be the best ways that you can prevent panic attacks coming forth that don't involve therapy or medication. And so that brings us to alleviating a panic attack. What can we do when we're currently experiencing a panic attack, and how do we get ourselves out of it? Okay, so the first thing that can be really helpful is calling out the panic attack and acknowledging it for what it is. So if you're able to sit and tell yourself, hey, I'm having a panic attack, I'm not having a heart attack, that's gonna reduce that initial anxiety that you're feeling. And especially when you're reminding yourself, I'm not gonna die, I'm not gonna pass out from this panic attack, and this is gonna pass in the next few minutes. That's gonna be a great way to help you kind of come back a little bit to the present moment and help your panic attack subside quicker. And the second thing, so we're gonna do a couple of breathing exercises just to walk you through it. The first one is called belly breathing. And for those who don't know, this is just breathing with your diaphragm, and pulling your diaphragm by pulling your stomach forward is going to give you a deeper breath by allowing more airflow in your lungs. So, and one helpful tip to remember is to exhale first, because we typically have some air sitting in our lungs, and then we can start labored breathing if we're trying to breathe on top of old air. So just go ahead and breathe out. And then you're gonna breathe in as far as you can and release. And you can repeat that until you start to feel better. However, there is another way to breathe if you're finding that that's not working, and this is called box breathing. And this is where you breathe in for a count of 4, you'll hold for a count of 4, and then you'll exhale for a count of 4. All right, and so we'll try that real quick. We'll breathe, 1, 2, 3, 4, and hold. for 1, 2, 3, 4, and exhale for 1, 2, 3, and 4. And you can repeat that as often as you need. It's especially helpful when you're lying in bed and your anxiety is disrupting your sleep. That can be helpful to get your breathing back in order and help you doze off. And so for a grounding exercise for when we're in the middle of a panic attack and we're finding that we are having overwhelming thoughts and intrusive thoughts, this is called the 5, 4, 3, 2, 1 method. And the way that you start that is you're going to start with one of those belly breaths that we just did. And then you're going to look around and you're going to try and find 5 things you can see in the room. And you're going to say those out loud. So for example, I can see the teal on my clock. I see the fish swimming in my aquarium. I see my coffee cup right here. The yellow of a dog leash and a vase with flowers in it. Okay, and then the next thing you're gonna look for is 4 things that you can feel. And you're gonna wanna do this with external feelings because sometimes, you know, like with those symptoms, if we're reporting, oh, I can feel my heart pounding in my throat, it's gonna make that a little worse. So for 4 things I can feel my sweater on my arms, the socks on my feet, I can feel the air circulating in the room, and I can feel the warmth of my coffee cup as I hold it. Okay, and so the next thing you're gonna look for is 3 things you can hear. And you know, this can be things outside, inside, it's not as specific. So things that I can hear right now are, I can hear the water filtering through the aquarium filter that I own. I can hear cars going outside in the parking lots. And then I can also hear the air circulating in the room. Okay, and so the next thing that you can look for are 2 things that you can smell. And as we get to 2 and 1, these can be a little more difficult to identify. So if you're having trouble with, you know, identifying something you can smell, think of your 2 favorite smells and try to visualize those. So I am actually not able to smell anything right now, but a couple of my favorite smells would have to be coffee, fresh coffee grinding, especially in a coffee shop, or fresh baked bread. Those are really great. Okay, and so now that we've gone on to that, the last one will be one thing that you can taste, whether that is something that, you know, you're tasting that's still in your mouth, or like if you're drinking coffee like I am, you can say I can taste my coffee, or go back to your favorite thing to taste. And another variation of this is saying one nice thing about yourself. And that can, you know, even make us feel even better, and it's really up to you. And then so after you identify that last thing, you're gonna take another belly breath. Okay, and then the second technique is called progressive muscle relaxation. And what we do there is we're gonna clench and release different muscle groups in our body to feel, to take note of how they feel currently versus how they feel after we relax. So we'll start with our feet, and I'll go ahead and walk you guys through this. So let's start with our feet, and make sure you're curling your toes, really clench really tight. So we're gonna clench, 2, 3, 4, and release. Do you feel that difference? And so next we're gonna go up to our calves, and we're gonna squeeze our calves really tight. So squeeze, 2, 3, 4, and release. And now let's move on to our thighs, and let's squeeze our thighs really tight for 2, 3, 4, and release. And then we'll move on to our glutes. So squeeze your glutes really tight for 2, 3, 4, and release. And then after that, we'll move on to our abdominals. So we'll squeeze, 2, 3, 4, and release. And then we can move on to our chest and squeeze our chest and our back really tight. 2, 3, 4, and release. And then our last one, we're gonna squeeze our fists and our arms. So we'll squeeze really tight, and we'll hold that for 2, 3, 4, and release. And the hope that now you can feel your body is much more relaxed, and with that, hopefully you're feeling more calm. However, if you're still feeling anxious after trying both of these exercises, one thing that you can try is going for a walk outside and repeating the 5, 4, 3, 2, 1 method and seeing what you notice is different. Okay, see if there's any questions or anything. I'm not seeing any. All right, well, thank you so much for taking a break with us, and we hope to see you for another coffee break soon. In the meantime, take care of yourself and others, and remember, we're always here to help. If you or someone you know is experiencing a behavioral health emergency, crisis counselors are available every day, all day. You can call us at 970-347-2120, or you can text TALK, T-A-L-K, to 38255, or walk in any day to 928 12th Street in Greeley. Thank you so much, and I hope you guys have a great Memorial Day weekend and enjoy your long weekend. Okay, bye guys.